In this video, our subject is positioning and lifting patients and residents. We will discuss getting ready, complications of immobility, the 6 basic positions, safety considerations, how to move a person up in bed, how to turn a person onto the side, how to perform log rolling, and finishing up. As nursing assistants, we pride ourselves on being able to empathize with those who are in our care, imagining how they feel in any given situation and anticipating how our actions will affect them. So let's imagine for a moment what it would be like not to be able to move or change position. It would be uncomfortable, right? Worse than that, long periods of immobility can cause serious complications to a person's skin, muscles, and joints. Changing position frequently when we are lying down or sitting is what helps to prevent those serious complications and keep us comfortable. Although most of our patients or residents are able to move and change position as they need to, others may be too weak or ill, or they may have disabilities that prevent them from being able to reposition themselves. Assisting your patients or residents with repositioning will not only help them to be more comfortable, but will also prevent complications that could seriously affect their health. Preparation, that is getting ready to manage your work in a manner that is safe, healthful, and efficient, is key to successful health care. No matter what tasks you'll be performing during your shift, whether those tasks are planned or unanticipated, you will benefit from a routine of careful preparation. Begin each interaction with patients or residents by performing these steps. Wash your hands. Gather all needed supplies. Knock before entering the person's room. Introduce yourself using your name and title and greet the person by name, remembering that a friendly greeting helps establish rapport. Carefully identify the person adhering to your facility's approved method. Explain to the person the procedure you're about to perform and make sure the person understands before you begin. If necessary, show visitors where they can wait outside the room. Provide privacy by closing the door and curtains. As appropriate, drape the person for modesty. And then, throughout the procedure, see to safety using proper body mechanics and following all safety precautions for equipment use and infection control. When repositioning a patient or resident, there are specific other getting ready steps you can take to ensure the person's safety. Make sure that wheels on the bed or wheelchair are locked before you attempt to move or reposition a person. Plan how you will go about repositioning the person and get help from others if necessary. Make sure you are aware of any limitations or restrictions concerning the movement or positioning of the person. People in our care might need help repositioning for many reasons. They might be recovering from surgery, immobilized in a cast, or in traction, paralyzed, unconscious, or very weak. In all these cases, an inability to change position can cause discomfort as well as serious complications. While immobility can cause complications in almost every body system, the most common complication of immobility is pressure ulcers. Also called bed sores or decubitus ulcers, pressure ulcers form when bony areas press against a mattress, chair, or other surface. Pressure ulcers can even develop as a result of bed linens pressing on the top of a person's toes. That pressure slows down blood flow to the tissues being pressed between bone and the surface the person is lying or sitting on. The longer a person remains in one position, the more likely that person is to develop a pressure ulcer. How do we prevent pressure ulcers? A person who is immobilized or on bed rest must be repositioned at least once every 2 hours. When the person is repositioned regularly, there is much less likelihood for pressure ulcers to form. Another complication of immobility involves the bones and muscles. Contractures occur when a joint is held in the same position for too long a time. There is stiffness and shortening of the tendons, resulting in loss of range of motion of the joint. Loss of calcium is another complication of immobility, and one that results in brittle bones, making the person even more fragile. Respiratory complications of prolonged immobility include decreased oxygenation and pneumonia. Fluids and mucus settle in the lungs if the person is left in one position too long. This creates an environment favorable for the growth of bacteria, which can lead to pneumonia. Another serious complication of immobility is the formation of blood clots in the lower legs. Blood clots can form when blood flow from the legs is slowed due to a decrease in muscle activity from immobility. When you reposition patients or residents, observe them for signs or symptoms of complications of immobility, and be sure to notify the nurse immediately if you observe any of the following: reddened skin, especially over bony areas, that does not return to its normal color after gentle massage of the surrounding tissue. Pale, white, or shiny skin over a bony area. Tears, scrapes, or skin that looks burned. Hot, reddened, painful areas in the lower legs. Do not rub these areas because doing this could dislodge a blood clot, which could then move to a vital organ. A new occurrence of urinary or bowel incontinence. New complaints of pain on movement, and any disconnected or heavily draining tubes or drains. Six basic positions are used when a person must remain in bed or seated for a long period of time: supine, Fowler's, lateral, prone, Sims, and sitting. In the supine position, the person is simply lying on his back. The bed is flat, and the person's head is supported with a pillow. Optionally, pillows may be used to support the person's arms or hands. Pillows can also be placed underneath the person's knees, lower legs, or lower back. Fowler's position is a variation of the supine position. Instead of being flat, however, the head of the bed is elevated between 45 and 60 degrees. Semi-Fowler's position, also known as low Fowler's, is with the head of the bed elevated between 30 and 45 degrees. Semi-Fowler's position is comfortable for watching TV or reading. It is also good for people who have trouble breathing when they are lying flat. In certain situations, the semi-Fowler's position is required, such as when a patient or resident is on aspiration precautions, receiving tube feedings, or experiencing reflux problems due to hiatal hernia. High Fowler's position is with the head of the bed elevated 60 to 90 degrees. This position is useful during meals, where it aids digestion, and during grooming. In any of the Fowler's positions, the bed can be bent at the knees, or you can place pillows under the person's knees and calves. In the lateral position, the person is lying on his side, and it is the person's side that describes the position. Left side down is left lateral position. Right side down is right lateral position. In either lateral position, the lower leg should be straight and the upper leg bent at the knee. Place pillows under the person's neck and head, between the person's legs, and under the person's upper arm. Another pillow can be placed snugly against the person's back to keep him in the proper position. A modification of the lateral position places the person on his side, but leaning slightly toward the back. This position places less pressure over the trochanter area of the hip than the lateral position does. Both lateral positions are commonly used for people with back pain, those in need of spine pressure relief, and those in a body cast. A person in the prone position is lying face down. For comfort, turn the person's head to the side and put a small pillow under it. To make breathing easier, another small pillow is placed under the lower abdomen and pelvis. A third pillow is placed underneath the lower legs to keep the feet aligned and to prevent the toes from pressing against the bed. Many people find the prone position uncomfortable. Make sure you check with a nurse before putting a person in the prone position. When the prone position is used, it is typically for a short period of time. A person is placed in Sims position prior to receiving an enema. Sims position is also used to relieve pressure on areas susceptible to pressure ulcers, such as the tailbone. In Sims position, the patient or resident's head is turned to one side. The person is lying on his side, but will be nearly prone. The upper leg is bent sharply at the knee and is supported by a pillow. The upper arm is bent at the elbow, with the hand in front of the face, palm down. The lower leg is straight and the lower arm extends out from the side, hand near the hips, palm up. In the proper sitting position, the person's feet should rest flat on the floor or on the footrests of the wheelchair. The knees are bent at approximately 90 degrees and the calves of the legs do not touch the chair. The person's hips and back rest against the back of the chair. Paralyzed arms should be supported on pillows. A person who cannot hold his body upright for long periods of time may need postural supports to assist in good body alignment. As we mentioned earlier, a person who is immobilized or on bed rest must be repositioned at least once every 2 hours. The usual sequence is 2 hours on one side, followed by 2 hours in either the supine or Fowler's position, then 2 hours on the opposite side. When positioning and lifting your patients or residents, safety is of paramount importance, not just for the person you are moving, but for yourself as well.